and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Pearl Werfel and Dr. Herb Karpatkin, who will be talking to us today about MS fatigue. After a presentation from each of them, we'll open it up to your questions and answers, or comments rather. Now I'm delighted to introduce our first speaker. Herb Karpatkin received his master's degree in physical therapy from Boston University and a doctorate in neurology from Rocky Mountain University. He is board certified in neurology and geriatrics clinical through the American Physical Therapy Association and is a certified MS clinical specialist through the Consortium of Multiple Sclerosis Centers. He has held clinical posts at the Rusk Institute and Rehabilitation Medicine, Burke Rehabilitation Hospital, the International MS Management Practice, and academic posts in the physical therapy departments of Touro College and Hunter College. In addition to continuing to be actively involved in patient care, he is a tenured associate professor in physical therapy at Hunter College, City University of New York, teaching courses in neurologic evaluation and intervention, psychosocial aspects of healthcare and research design, as well as mentoring students through the research process. His primary areas of research are aimed at understanding and developing interventions that result in improved mobility for persons with MS. We're pleased to have him join us to present this important topic. Dr. Karpatkin, thank you for being with us today, and I'm going to turn it over to you.
Okay, thank you very much. I want to thank the MSF for inviting me to give this little talk. I have been clinically active in treating people with MS for the last 30 or so years. And to me, one of the most important things is to make sure that persons with MS are as knowledgeable about MS as they can be. So I always welcome any opportunity to talk to patients. So give me a moment to share my screen here. Got it here. Okay. So what I want to do is give the perspective of a physical therapist on multiple sclerosis and fatigue. Now, Dr. Werfel, who's going to be speaking after me, is going to be giving a different perspective, and hopefully between the two of us, we're going to be covering as large amount of the topic as we can. So I just want to start and say that fatigue in MS is, in my opinion, the most common symptom of MS. It impacts all aspects of mobility. And as a physical therapist, I look at MS as a disease of mobility. Persons with MS have trouble walking, balancing, rolling over in bed, reaching. And so as a PT, when I see a patient with MS, I think, how has their mobility been affected? In the issue of fatigue in MS, there is this vicious cycle of fatigue, immobility, and deconditioning, where somebody becomes fatigued due to the MS that leads to immobility because they're too tired to move. That leads to deconditioning, which leads to more fatigue, etc. And I see part of my role as a physical therapist as trying to intervene in that cycle. There's a very specific problem for me as both a clinician and a researcher for multiple sclerosis and fatigue in physical therapy. And that problem is the following, that for movement to improve as a result of exercise, a certain dosage of exercise must be performed. In the same way that when you take a medication from a physician, you have to take a certain dosage, exercise works the same way. You have to do the right exercise and the right amount of it for the exercise to truly be beneficial. The problem specific to multiple sclerosis is that fatigue prevents persons with multiple sclerosis from attaining that correct dosage. So you have this conundrum where you need exercise to restore mobility, but the primary symptom of the disease limits the ability to exercise. So let's take a step back here, and I'm going to try to define fatigue, or I'm going to try to define the part of fatigue that I'll be talking about. And I'm going to break down fatigue a little bit artificially into three separate categories. One is differentiating subjective fatigue from objective fatigability. Then I want to separate primary fatigue from secondary fatigue. And finally, I want to, oops, I went backwards. I want to differentiate cognitive fatigue from physical fatigue. So first, let's talk about subjective fatigue versus objective fatigability. Subjective fatigue is just what it sounds like. It's a feeling of fatigue, a perception of fatigue, of tiredness, lassitude, feeling overwhelmed. And Dr. Werfel is going to probably be talking quite a bit more about that. Objective fatigability, which is one of my primary areas, both as a clinician and as a researcher, is the slowing of a physical performance over time. And in some of my research, which I'm going to share with you in a moment, we see people with MS going for a walk, and literally every minute they slow down. They perform each minute slower than the minute before. Persons with MS can have both types of fatigue. They can have one, they can have the other. But it's unusual, in my opinion, for persons with MS to have no fatigue whatsoever. The other thing to realize is that subjective fatigue and objective fatigability are poorly correlated. Someone can have a great deal of subjective fatigue and little objective fatigability, or the opposite. Here's a video of what I mean by objective fatigue. Now, this was in the old days when I had my private practice, and the gentleman lying on the mat, I just asked him to do as many straight leg raises as he could with his left leg. The gentleman standing next to him is a member of my staff, just giving him a target for him to touch his leg to. And I just said, do as many as you can. So what you'll see here when the video plays is the first couple look really strong. And then each one literally gets a little bit weaker. My assistant is trying to help him out by lowering his hand each time. Okay. But as you can see, even by the fifth or sixth one, he's having trouble. And that's really specific to MS. If I just tested him for the first one, he'd seem very strong. Right now, he's trying harder and harder. If you could see his face, he'd really be grimacing, but he just can't raise it up any higher. And that is the classic sign of objective fatigability. Okay. Okay. Next, I want to differentiate primary fatigue from secondary fatigue. Primary fatigue means it's really due to a specific aspect of the disease, that there's something specific to multiple sclerosis that leads to this fatigue. And the primary fatigue that I'm talking about is something that goes by the long name activity-dependent conduction block. And all that really means is that as your body heats up as a result of exercise, the conduction through the demyelinated nerves decreases. So the warmer your body gets, the harder it is for impulses to travel through those demyelinated nerves. And that is what leads to the fatigue. Secondary fatigue is really more a result of lifestyle changes and adaptations that occur as a result of the disease. So what I mean by that is, if the primary fatigue makes it harder to exercise, so you exercise less. As a result of that, you become less fit, and exercise becomes even more fatiguing. So persons with MS, in my opinion, usually have both, and there is a strong connection between the two of them, a vicious cycle or a vicious circle. And here's what the circle kind of looks like. So you see the person is fatigued. As a result of the fatigue, they decrease their activity. As a result of that decreased activity, They become deconditioned, which leads to more fatigue, et cetera, et cetera. And all this amounts to, all this results in persons with MS doing less and less movement, becoming more and more deconditioned, and actually even forgetting how to perform certain tasks like walking long distance or balancing. And so a lot of physical therapy becomes trying to help the person relearn how to perform physical movement. Okay, cognitive fatigue, which I think is very important but rather overlooked in MS, is a fatigue that occurs resulting in difficulty with concentrating on something for a long time, paying sustained attention, staying focused, holding a lot of memories, abstract thinking. Okay? And it's important to realize that physical fatigue can increase cognitive fatigue. One of my colleagues, Dr. Marissa Barrera, once did a study with me where she had patients perform cognitive tests. Then they engaged in a fairly difficult biking maneuver where they had to ride a stationary bike for a period of time, and then gave them the same tests, the same cognitive tests. And the cognitive performance decreased after the physical fatigue. Also realize that cognitive fatigue can be primary and secondary, just like physical fatigue. Okay, so now that I've done this brief explanation and description of what fatigue is, what are we going to do about it? And I'm a physical therapist, so what I'm going to try to do about it for most people is try to help you with exercise. And I want to talk about 3 specific aspects of exercise. First, I want to talk about the dichotomy between what I would call therapeutic exercise and wellness-based exercise. I want to talk specifically about interval training, which is where a lot of my research is. And I want to also talk about task-specific training. Okay. Oops, going backwards here. Okay, so I want to differentiate. Looks like I skipped another slide. Nope, didn't. So task-specific training refers, or therapeutic exercise refers to using a specific exercise to address a specific need. As I said before, I think of exercise in the same way I would imagine a physician thinks about medicine. You would give the right medicine to treat specific symptoms. Okay? You wouldn't take penicillin, for example, to treat muscle aches. You take penicillin because somebody has a problem with infection. It's the same deal with exercise. The exercise must meet the specific need. So the example I like to give is the example of foot drop. Now, I think most of you know what foot drop is. It's a tightness of the calf muscle and a weakness of the muscle in the front of the shin called the tibialis anterior. As a result of it, the foot drags along and sometimes the foot catches and people fall. You need specific exercises to fix that. You need to stretch the calf, strengthen the tibialis anterior, and practice walking with good heel strike and toe off. Doing other exercises, doing exercises that are based on wellness, say riding a stationary bike, may improve your overall fitness. It's not going to improve the foot drop. So I'm going to tell a quick story about this because it's very illustrative. Many years ago, a gentleman came to see me, a gentleman with MS, and he said, "Herb, I've heard your talks, and I got to say, exercise hasn't helped me. I exercise a lot, and I still fall all the time." I asked him what exercises he did. He said, "Well, I ride a stationary bike, and I swim, and I lift weights, and I do push-ups, and I do sit-ups." And he was very, very fit. He was in good shape, but he had 2 big foot drops, and he was not doing anything about them. So he was exercising, but the exercise did not address the problem that he had. So when I'm talking about exercise, I'm talking about exercise that meets your specific needs as a person with MS. Everybody with MS presents differently, presents independently, and you need a specific program to address your specific needs. The next thing I want to talk about is what's called interval training or high intensity interval training or intermittent training. And all this really is interspersing rest breaks with periods of exercise. So rather than exercising continuously, you take breaks. Okay? The rationale behind why this works is the rest breaks probably allows your core temperature to decrease, so you get better conduction. And what we found in our studies is when people walk intermittently, they'll walk a longer distance than if they walk continuously. So this is a study we did at Hunter a couple years ago, and we had patients with MS walk in two conditions. In the first condition, we just said walk as far as you can in 6 minutes without stopping. And then they came back a week later and we said walk for 2 minutes and then rest for 2 minutes. Walk for 2 minutes and rest for 2 minutes, walk for 2 minutes again. And in the continuous walk, every 2 minutes, as you can see on the graph, they decreased the distance that they walked. Whereas when they took breaks, they actually increased and then maintained. So by the simple expedient of asking people to take breaks when they walked a much longer distance than if they walked continuously. And this was really important news. It meant that I could have my patients walk longer distances, do a greater dosage of walking if they simply took breaks. Okay. Similar to that is something that's been in the news a lot called high intensity interval training. And it's something that used to be done by athletes. And to be honest, a million years ago, before I was a PT, I was a track and field coach. So I'm very familiar with interval training. And there's this suggestion right now that persons with MS could benefit from doing very high intensity interval training where you intersperse very short, fast, intense walks or some type of exercise with long recoveries. And one of the reasons it's thought that this is working, that this works so well, is that when you walk fast, you utilize different musculoskeletal and neurologic mechanisms than if you walk slowly. Walking fast is different for your body than walking slow. So what we did in our study is we had a small number of patients and they did 20-second walks, quite short, as fast as they could, however fast that was. Then they would rest for 2 to 3 minutes, and they would do this 6 to 12 times, twice a week for 6 weeks. And what happened? Well, as you could see, for the 6-minute walk test, their distance they went from 930 feet to 1,139 feet, or a 200-foot improvement. And all they did a couple fast walks a week for 6 weeks. They also, not surprisingly, we timed how fast they could walk for 25 feet, and they also got much faster. So this was really exciting to us, that patients who had really poor performance in their 6-minute walk test due to their fatigability, by simply practicing a few short walks every day, would make these really large, significant improvements. So we were very excited by that, and we're about to start a much larger study. This was only with 9 patients. We're about to start a larger study at Hunter where we're going to try to have a larger group and more controls. Okay, what else can we do to limit the impact of fatigue? I want to talk about 3 specific things. First, the use of cooling, and then went backwards again. Then how you can use hydration, and also what is the impact of diet. Okay. Cooling in multiple sclerosis, and I have to give my shout out right now One reason why the Multiple Sclerosis Foundation are MS heroes, in my opinion, is they have a free cooling vest program. And I urge all of my patients to take advantage of it. And as a matter of fact, a study that I'm about to tell you about, the MS Foundation helped me get cooling vests for the study. But let me back up a little bit. A primary issue for fatigability in multiple sclerosis is thermosensitivity. That increases in core temperature, as I said before, decrease conduction through demyelinated nerves. So how can core temperature increase? Well, it could be external, that the weather could be too warm, or the room that you're exercising can be too warm, or the core temperature can be internal, either from a fever or from prolonged exercise. And that's a big problem. If exercise is needed to help you with your mobility and your fatigue, but exercise heats you up, what are you going to do about it? Well, we have to find a way to decrease the core temperature. If you decrease core temperature, you can decrease fatigue. So what can you do? Well, a lot of it's pretty straightforward. Some of it just asking people to continue to sip from really cold drinks while they're exercising will cool down the core. You need to make sure that the room that you're exercising is cool enough. You can't wear really tight, warm clothes because that will heat up your core faster. And something that people just don't take enough advantage of is cooling garments. Okay. So over here, this is a picture from my old practice. This young man is wearing a vest, a cooling vest, right before it's time for him to start his exercise program. He's doing something called pre-cooling. So if his appointment was at 12, I would have asked him to come in at about 11:30, and I would throw the cooling vest on him and give him something to read, and said, in about a half an hour, we're going to get to work. This was the room. Next to it is the room where we did a lot of our exercise, and you'll see 2 air conditioners, and you'll see also a dehumidifier. Off to the side, you can't see it, but there's a couple of fans. So we tried to keep the exercising room for MS patients as cold as we possibly could. And the way how we knew it was cold enough is when my staff said it was too cold, but my patients were all happy, I knew I'd found the right temperature. So this is a study we performed at MS, we performed at Hunter, and we're getting it ready for publication now. In the experimental group, there were 17 persons with MS, and all we had them do was wear the same cooling vest that the MS Foundation provides, for 30 minutes before they did a 6-minute walk. Okay? And then the control group did the exact same thing, except no cooling vest. So in one condition, they just sat for 30 minutes without a vest. In the other condition, they wore the vest for 30 minutes. And you'll see that in the experimental group, or the cool group, they walked about 50 feet further, okay, 795 feet, than in the control group, who walked 749 feet. Okay? There was no other type of training. There was nothing different. Just one group was cooled and the other group wasn't. And interestingly, the group that was cooled said they felt they were walking slower, when in fact they were walking faster. They didn't particularly like the vest. They said it wasn't really fashionable enough for them. But once they saw how much further they walked, they got very excited by it. Okay, a couple more things before I hand over to Dr. Werfel. If there's one thing that I could tell all persons with MS to do, it's to drink more water. If you look at this slide here, you'll see that our body is mostly water, particularly our brain, including our spinal cord and our muscles. So if you're dehydrated, you're literally decreasing the effectiveness of your brain and muscles. And as persons with MS, you cannot decrease the effectiveness of your nervous system or your muscles. So I am continuously asking my patients to try to drink more water, make it cold, sip it throughout the day. But the number of times a patient has come in and has had poor physical performance, and then I have them drink a glass of water and get back to work, and they're working much better, happens to me far too often. All right, next slide. Okay, everybody asks me about diet, and I've heard a lot of the things talk about an MS diet. And I sure wish there was an MS diet. I sure wish that you could fix MS by eating certain foods. As a scientist, I have to tell you, there is no evidence for that. That doesn't mean you can't impact your MS with diet. There is improvements in health that are obtainable from a healthy diet. Okay? Eating a diet that is low in fat, moderate in carbohydrates and protein is going to help anybody. Increasing weight, if you're eating and you're gaining weight as a result, that's going to increase your fatigue, because the more you weigh, the higher the energy cost of movement. Alcohol, I don't want to tell people to not have a glass of wine with dinner. I think wine is, a very wonderful thing, but drinking too much certainly dehydrates and increases the need for water. So I get asked all the time after I talk about this, so what should I eat? And to answer that question, I'm going to go to one of my favorite authors, Michael Pollan, who, when asked that question, says, eat food, not too much, mostly plants. So by eat food means avoid processed food, eat fruits, eat vegetables, eat beans, eat legumes, eat grains, okay? Stay away from processed foods, okay? Second, don't eat too much. And as a whole, Americans eat too much, okay? And as I said before, mostly plants. Okay? I do know a certain number of persons with MS who went on a vegan diet and they were really happy with it. And they said, oh, I found the MS diet. And I said, no, you found a healthy diet. Okay. I was lucky early in my career to work with a neuropsychologist who studied sleep in MS. And one of her conclusions was overall, persons with MS have poorer sleep than those without. And that's a big, big problem, because with less sleep, you're going to have a greater amount of fatigue. So there's a number of simple rules that you should follow to help sleep hygiene. This is from the CDC, and it's the same for everyone. And I honestly try to follow them as well. Firstly, be consistent. Try to go to bed at the same time each night and get up at the same time each morning, including on weekends. You can't bank sleep. You can't, if you're really tired, sleep 12 hours and then go back to it before. Try to have the same amount of sleep every night. Make sure your bedroom is quiet, is dark, is relaxing, and it's a comfortable temperature. Try to figure out what conditions are the best for you for sleep. The third thing, and this is very hard for a lot of people, especially my kids, is get rid of the electronic devices. Get them out of the bedroom. Don't tap away on your computer or watch TV before you go to bed. The screens tend to increase alertness. And so don't take your electronic devices to bed with you. Avoid large meals right before you go to bed. Try to make your last meal an hour or two at least before you go to bed, so your body is not working to digest the food. Similarly, avoid caffeine. That should be obvious. Avoid alcohol. It may help I know it helps some people fall asleep, but the quality of your sleep is much poorer with alcohol in your system. And finally, as a PT, I have to say this, get exercise. Being physically active during the day can help you fall asleep more easily at night. And this is something all my patients tell me, that the more they exercise, the better their sleep is. So it's an added benefit. Okay, couple more slides. People always ask me about mobility aids, the use of splints and canes and walkers and wheelchairs. And for me as a PT, there's a real paradox with using them. So certainly the use of mobility aids such as these splints and canes and whatever, they can increase mobility and they decrease the energy cost of movement. If somebody really is struggling to walk because of foot drop and they're walking less and less as a result, and you give them a splint and a cane and they're walking longer distances, that's all good. But here's the problem. Sometimes using those mobility aids can prevent you from using the parts of your body that need to be used. So I believe I have an example on the next page. Okay, consider this issue again of foot drop or foot drag. And I imagine most of you who are listening right now know what foot drop and foot drag is. And as a PT, it's a very important issue to me because it leads to catching the toes, and that often leads to falls. And it's something I look for in every patient I see. The reason for foot drop is usually a combination of weakness of the muscles at the front of the shin, tibialis anterior, and tightness in the muscles of the calf, the gastrocnemius. Okay? So a splint can limit the effects of foot drop by holding the foot in place. The problem is that by holding the foot in place, it makes the foot weaker and tighter. The foot, as a PT, what I want you to do is to stretch and strengthen that foot. A brace keeps the foot from moving, so it won't get more stretched out, it won't get more flexible, and it won't get stronger. So I'm very often a little bit leery about prescribing a splint for a patient right away. First, I always want to give physical therapy a try, because if we can solve the problem without splinting by using an exercise program, that I think is superior to a splint. If the exercise does not work, then absolutely I would recommend a splint. If the person cannot walk longer distances without a cane, then absolutely we get a cane. But I always like to try exercise first. Okay. So I believe this is my last slide, and I'm going to make the following comments here. So instead of thinking, if you're having difficulty with walking or difficulty with fatigue, before considering a cane or a splint or a walker, consider exercise or physical therapy first. If a muscle is weak, it can be strengthened. I've been working with persons with MS for 30 years, and people with MS get stronger with exercise. There is no question in my mind about that. Similarly, if a muscle is tight, it can be stretched. And pretty much every single patient I work with nowadays is on a stretching program for their calf muscles. If a task has become more difficult, practicing the task can make it easier. And so a patient who has difficulty with balance, for example, will very often start avoiding activities which stress their balance. And as a result, they become worse and worse at balance, and they fall more. What I try to do in that case is make the person practice balance tasks. And as a result, they get better at what they practice. If stretching and strengthening alone is not effective, then I always suggest that the patient try a mobility aid along with stretching and strengthening. And finally, not all PTs are the same. Look for a PT who has expertise in MS. They are out there, and I can help you find them if you're looking for one. But don't underestimate the impact that physical therapy can have on helping your mobility and limiting your fatigue. And I believe that's my last slide. I'm going to stop my share. I see there's a few chats and a few questions, but we'll save them for after Dr. Werfel's talk.
Thank you so much, Dr. Karpatkin. That was incredibly helpful information. I remember you once before saying you want it to move, you got to move it. Remember, and I've told that to everybody I know. If you want it to move, you have to move it. Can't just wish it to move, you have to try. So
Yeah. You get
good.
good at what you practice, and you get bad
Exactly.
at what you don't practice.
Thank you. So our next speaker is Dr. Pearl Werfel, PhD, who's going to be telling us more of the psychological and emotional aspect of MS fatigue. And I'm going to let Dr. Werfel tell you all about herself. Let's see, I think you're off of, yep, you're not on mute.
Hey, can you hear me?
I can.
Okay, and you're seeing my PowerPoint.
It's perfect.
Oh my goodness, how often does that happen? Whoops. Okay. Hi, I'm Dr. Pearl Werfel, and I'm a psychologist in private practice. I have expertise in wellness and MS, pain and stress and anxiety mitigation. And right now, I'm going to take just a minute to see if I can make this really small so it's not getting in my way. Okay. Thank you. I'm living and working in the San Francisco Bay Area on Chichenyo Ohlone land. For those of you who can't see, I am an older white woman with short graying hair. I've led groups and workshops for people living with MS for over 25 years. I wrote a book, co-author a book on MS for mental health professionals, and I've done a lot of training of mental health professionals. I'm proud to say that I'm a member of the MS Foundation Health Advisory Council and the National Multiple Sclerosis Society Health Provider Council, and I'm a consultant with Can Do MS. And I want to thank you so much for inviting me. And hopefully I'll have some things that will supplement what Dr. Karpatkin has just shared with us. I'm going to be talking about managing fatigue, and we have a picture here of a woman lying down. The gas tank is on empty. We know what this feels like, and we want to try to prevent this level of exhaustion. So we've already talked about that fatigue is one of the most common symptoms of MS, and it occurs in more than 80% of the people. And it is one of the primary causes of early departure from the workforce for people with MS. Dealing with fatigue is really frustrating, as we all know, because it waxes and wanes. So you might not know, will I have the energy tomorrow to be able to do this? So there's a lot of adjustment that has to happen. And shockingly, better managing energy increases strength. And you can do that with education, energy budgeting, relaxation, and of course, exercise is so important. So I want to talk for just a minute about MS and fatigue and depression, because people sometimes confuse this. On a broad scale, the difference between MS fatigue and the fatigue of depression is that desire but no juice. You probably have had the experience of, I really want to go to that party. I really want to go do this, but I just don't have the energy, versus kind of feeling like I don't even want to go. Over 50% of people living with MS will experience depression at some point in their lives. So it's really important to understand that this can be a part of living with MS. It can occur at any time and with any disease course. And for people that believe that, oh, depression, you just have to push through, this is a physiological occurrence. So this is something else that we need to say, okay, I need to get some help with. One of the things that is a hallmark is symptoms last at least 2 weeks to several months. And it is best diagnosed by a mental health professional. So what does it look like? Loss of interest or pleasure in everyday activities. Fatigue looks like I'm tired, but depression is loss of interest, loss of appetite or increased appetite, sleep disturbances, either not being able to sleep or the excessive sleeping. And again, that excessive sleeping that is coming from everything kind of just being flat. I'm just going to skate, put the covers over my head. There can be agitation. People can be irritable, or that feeling of just moving through a quicksand. Everything goes so slowly. And fatigue comes with depression. So wouldn't that be nice to be doubly hit with both depression and MS fatigue? You have a lot of fatigue there. There's a feeling of worthlessness or guilt, and that's a really important thing to think about. Feelings of worthlessness or guilt do not come with MS fatigue. That's something else. Problems with thinking or concentration, and a really important one, the thoughts of death or suicide. So I've given you pictures. So another illustration of the difference between fatigue and depression. On one side, you see a young woman of color, and she's just kind of got her head on her hand and she's staring at her phone. This is a illustration of that kind of shutdown that can happen with fatigue. On the other side, we have a cartoon of a woman that is, her shoulders are hunched. She's just dragging herself to that chair and her head is kind of spinning. Many of you may have experienced this level of fatigue. This is what fatigue looks like, that just, I don't have anything else left. So one more moment on depression. It's important to consult with a mental health professional. Exercise can be really helpful for managing depression. If exercise isn't helping, or talking to someone that a friend isn't helping, then the next step is looking to talk to a mental health professional. Short-term psychotherapy is really helpful for mild depression. And if it's a more severe depression, the research has shown a combination of psychotherapy with short-term medication can be really helpful. People are afraid that once they start on some kind of antidepressant, they're going to be on it for the rest of your life. And that's not what the studies show. I'm talking about short-term to enable changes to happen in psychotherapy. I know that fatigue and cognition was just spoken about, but I just want to bring it back around here. Again, we have a woman with just her head on the desk, completely exhausted. So is this exhaustion or is this cognitive fatigue? Physical fatigue does have an impact on cognitive performance, but less than people think. There's that cognitive fatigue, that decline in cognitive performance that happens when there's a challenging task that's happening and all of a sudden, oh, I can't think through this anymore. Or that stamina, that ability to be able to do a number of different cognitive things that can happen even in the absence of physical fatigue. So if you're feeling like, okay, I have energy enough, but I'm just really struggling to think through this, that's time to consider a consultation with a neuropsychologist. And I know these are just broad statements that I'm making, but I'm just trying to give you a brief overview here. Here we go. We got something else that depletes energy, and that's anxiety. Excessive worry, that wound up tense, restless, difficulty concentrating, thoughts or feelings. Now, of course, most people can be anxious about something from time to time. And I think we saw worldwide anxiety when the pandemic first began, where it became normal to have excessive worry and to be wound up. That was the way everybody was. But we're talking about a sense of anxiety that is just happening on an everyday, that constantly running through things. What I say is like the mouses won't get off the wheel. They won't stop rethinking that thing I said yesterday or I did yesterday. I hear this often from my clients. And people with MS can have a preparatory anxiety. Oh, I'm so anxious because last time I went out, I was having trouble and I almost fell, and now I'm afraid to go out because I might fall again. Or what happens if my MS gets worse? It's thinking about the future and the anxiety that builds up. If it's normal to have some anxiety, which it is, we need to find out how to cope with it. If the anxiety is taking over and there's a constant worry about, will my MS get worse? Will I fall? Will I be able to find a bathroom if I go someplace? And you've done things to try to work with it and you're still anxious, again, time to get some help. And then stress. We have here a woman pulling out her hair. Most of us have been here at some point. Again, we experienced this internationally in the beginning of the pandemic or at some point in the pandemic. Stress happens. But what happens with stress is unregulated stress. That stress that's ongoing causes inflammation. Any stress causes inflammation, but it can cause chronic inflammation. And we know MS is related to inflammation. So stress is not going to help the MS. Stress also causes sleep disturbance. I don't know if I've ever met a person that didn't have a bad night's sleep once or twice because of worrying about something. All of this causes exhaustion, and inflammation also causes pain and discomfort. And pain and discomfort cause sleep disturbance, which causes fatigue and more stress. So it goes around and around and around in a circle, and the place to stop is up at the top with doing something about the unregulated stress. So it's really important for us to increase our stress tolerance, which means even though you may hate it, acceptance of MS. I have MS and this is what it's brought. And rather than struggling against it, I want to find a way to work with it, because fighting against reality, wishing it was different or pushing against it actually is exhausting. And that increases fatigue. We want to do what cognitive behavioral therapy has brought us: positive self-talk and negative self-talk. Positive self-talk is reality-based thoughts. An example, yeah, I'm having a hard time. This is difficult. What can I do to help myself? What kind of help do I need? Rather than staying with, I'm having a hard time, I'm going to continue to have a hard time, it's not going to get any better, and then spinning out on that, which is negative self-talk. Any kind of self-care that really is self-care, and that's something for you to evaluate. If it's working, then it's probably helpful for you, which includes exercise, sleep, enjoyable activities, and many other things that are included in self-care. For some people, self-care is binge watching something. If you feel better afterwards, if your stress is lower after you've taken a break and binge watched something, that's wonderful. If it hasn't changed for you, then that is not self-care for you. That's a zoning out, which can be indicative of a depression or another kind of exhaustion. And the big one, asking for and seeking the help you need. Whether it's asking someone else to help you with something because a task is becoming overwhelming, or seeking outside help, professional help. And sometimes we need more help. I know that the two places people have trouble going to is getting that referral and going to a psychotherapist, and also going to a physical therapist. I've heard this often, that people don't think that they should go see a psychologist or a psychotherapist unless they're extremely depressed, or should they go see a physical therapist until they're really having trouble walking. If you're struggling a little bit, that's the time to get help, because I can help you so much better at the beginning of a struggle than I can if it's been going on for years. I can still help you then, but then we need to go back and do the reparative work of years of this pattern. So much easier to intervene in the beginning, saying, you know what, MS is difficult for me. I'm really having a hard time living with this. I'm going to go get some help. It's a great thing to do. And some of the management tools for stress, anxiety, pain management include imagery, hypnosis, mindfulness, somatic experiencing, energy psychology. I know I'm giving you a short list of this because that's not what this particular webinar is about, but I'm just putting the names out there that there are mental health professionals that can have many tools to help you in managing the anxiety, the pain, the stress, so that it doesn't impact your body as much. You're not as fatigued. Relaxation training. Going to a support group can be really helpful if it's a nice, healthy support group. And psychotherapy, talking it out, can be helpful, as well as occupational therapy and physical therapy. So we have a picture here of a cartoon of a dollar bill, big smiling dollar bill with thumbs up. That's how we like to be with our money, but it's also how we want to be with our energy, feeling like, hey, I got the energy, I got this. Now, some people may never feel that they've entirely got their thumbs up, but it may be, hey, I've got my thumbs up for today. I've got some energy today. The other way illustrated is this on the side piggy bank with a frown, totally broken, just a couple coins left there, just a couple of bills left there. That's complete depletion. And we don't, in our finances, ever want to get to the point where we're, oh my God, do I have another penny? Do I have another nickel? Nor do we want to be there with our energy in our body. So if you have an idea of how to manage your finances and you've been doing that successfully, you can use that to figure out how to manage your energy. And we'll look at that energy budgeting, which is what I just talked about. And then we'll look at energy conservation and the 4 Ps. Some great tools coming up here. I hear a lot, I will just push through. I can just push through. I hear this often. Pushing through has a big downside. Sometimes we need to push through. Sometimes we need to say, you know, I'm really tired, but I want to participate in this activity. I'm going to get dressed and I'm going to go do it. Or I'm going to finish this bit of work. Sometimes we have to, but doing it on a regular basis is not a way to manage fatigue or MS. So I learned from a wonderful woman in a webinar I did. I could probably just have this, and we could just talk about this for the rest of the time, which is backing up versus beating up. If you are pushing yourself and saying, I should be able to do this, what's wrong with me? Why can't I do this? It's time to reevaluate. It's time to back up and evaluate how much energy you really have. I had a client not that long ago say to me, I don't know what's wrong with me. Client living with MS who's newly using a mobility aid as her MS has progressed. She said, you know, I got up, I took a shower, I had some breakfast, and I got dressed. That's all I did. And now I'm exhausted. And she was so frustrated. And what was important to realize is she was really struggling with fatigue. Getting up, getting that shower, getting dressed, eating was actually a big thing for her to be doing on that day. And by saying, whoa, you know what? Okay, maybe this is okay. Her stress level went down, and she reported that after we talked about this, she actually had some energy to do her PT exercises. So pushing through and beating up don't work, they deplete. I could probably just say that and then not continue with anything else, but I will. Energy conservation. Again, these are broad things, but what's important is you need to learn about yourself, and I'll talk about that in a minute. Find a good balance for yourself between work, rest, and play. The key word here is balance. Really important. Find out what works for you. Planning is really important. Plan to rest before you feel tired. Give yourself a break. Pushing through to exhaustion and then taking a break is not going to work, because then you have to repair. But if you know your ability to work or ability to do exercise, whatever it is you're doing, and you plan that rest. I think we were just talking about, Dr. Karpatkin was just talking about the intermittent exercising. Well, that works with life activities. Plan that break, plan that rest. Take those short, frequent breaks. And something that's really important is a stimulation break. For people that are having fatigue or cognitive fatigue, neuropsychologists are finding out that just a short period of time, even 10 minutes with eyes closed and nothing coming into the ears, no looking at the phone, no listening to music, no hearing anything, for really even 10 minutes can bring restoration. Often people take breaks and then they start looking at their phone, and that's increased stimulation. That's not going to help with cognitive fatigue. So the big deal is to stop and evaluate. If you don't know how often you need to rest, if you're trying to learn your body, stop. Stop every 15 minutes or a half an hour. You can stop for a minute or two. Just check in, say, okay, how much energy do I have doing this task? How much more do I have? Oh, I'm doing pretty good. Oh, I can continue. What's the position? If you're sitting and working in front of a computer, as so many of us have been, are you holding yourself tight? Are you leaning forward? Are you supported? Are you asking your body to work harder? Do you need to change your position? Are you hungry? People get into their tasks and they don't even realize how hungry they are. So stopping and having something to eat. And that's not, mindless snacking, but giving yourself what you need. Already was talked about thirst. When's the last time I had a sip of water? Okay, it's time for that. Also looking at your discomfort and your stress. And if you're feeling overstimulated, you might need to shift the task you're doing, whatever that might be, because there's just too much input coming in. And then we have the 4 Ps. Prioritize is what needs to be done today and what can wait. We had this feeling, I want to get it all done. Really evaluating. Does it really need to be done? And do I really need to do it? Because sometimes we do a lot of make work for ourselves and we realize, you know what? I don't really need to do that. I need to prioritize something that really needs to be done today. And what is the best use of my energy right now? It's really important to plan, to, before you start something, maybe have your supplies already gathered before you start something, so you don't have to be going across a room getting something or going here or going there. It's already organized for you. Have a chair nearby. So if you're doing something that requires a lot of moving around, have something where you can sit down and you don't have to kind of drag yourself over to it. Alternate kind of heavy and lighter kinds of tasks. And what's important is sometimes, rather than skipping that social activity or feeling like, oh, I don't have the juice to participate in the social activity, is saving some energy, skipping something. Find the pace that works best for you and your body. Be realistic about what you can accomplish in an hour or a day, and try to complete as many tasks as possible, as quickly as possible. That leads to exhaustion. So the pacing, we want to really know what works best for your particular body. And thinking about body position, as I talked about before. And is there an adaptive equipment that might make it easier to do some of the tasks for you, that can allow you to do more? So really getting to know yourself, one of the ways you can do that is by keeping a log. And you can do this any way you want. You can jot something down. You can have an Excel sheet, however it works for you. You're really looking at the amount of sleep you get and the quality. If you do this for 2 to 3 weeks, you'll really learn yourself. Eating when you're hungry. What kind of ingredients did you use? At what time did you eat? Drinking, how much water, how much alcohol did you have? What type of exercise you did? How long did it last? How intense was it? And what time of the day? Sometimes if you shift the time of day you do it, it can work better for managing fatigue. What's your mood? Really important to look at. How often are you down in the really low happiness and the really high stress? How much work are you doing? And we're talking about paid and unpaid work. How often are you taking breaks? Different kinds of social activities. Look at what time of the day is it and was it enjoyable? And then look at, excuse me, the amount of energy that you have at the end of the day. Are you depleted or energized? If you do this for a shorter period of time, you will learn your body and learn yourself. So it's important to be body aware. Our bodies are in charge. Those of us who are living with MS, we need to learn to dance with MS. Rather than telling our bodies what to do, we need to learn our bodies. What's our strength? What's our limits? That way you'll be able to better manage fatigue. The log will help with that. But for some people, body awareness brings distress. What if I check in and discover discomfort or exhaustion? No, I don't want to know. I'm just going to push through. And I don't like the way my body feels. I feel like when I check in with my body and see what's going on, I notice all my symptoms. I don't like it. I don't want to be aware. I understand that. And I often hear this from people in the beginning, but being body aware allows you to learn your body and learn your body with MS, which allows you not only to manage fatigue, but also a number of other things like pain and discomfort. When you're uncomfortable, it's natural not to want to check in with your body. But any anxiety, pain, stress management technique that helps you manage with your body is going to ask you to check in and notice, where is that stress? What's going on? So you might initially feel uncomfortable checking in. And some people initially have a really hard time with things like physical therapy, because it means they have to get into their body. It's psychologically difficult for them. If you have a history of trauma or abuse, checking in with your body sensation or having someone touch your body or learning to move your body may initially increase your anxiety. And if that's happening, I really want to encourage you to get some help. But don't give up on it. It gets better. So I want to, just for a minute, because we are a little bit behind schedule, so just for a minute, give yourselves that opportunity to take a breath, because we're almost at the end of me talking, and a chance to invite you to ask some questions. You can look at this, or you can notice the most comfortable part of your body and just take that minute. See how you're sitting. What's your position? Are you comfortable the way you are positioning yourself? Do you need to take a drink of water? Ask yourself. This is that time. This is an example of just checking in. Do you need to look away, look outside like I'm doing right now to get away from the computer screen, to rest your eyes is another big one? Or would you prefer to look at the water? So I'm just giving you an example for a half a minute. What I'm encouraging you to do for a couple of minutes, check in with yourself and your body and let yourself acknowledge where you are honestly, and then see what you need to do to shift that. And to end with, yes, you've heard lots of great things from both of us. Then I also often hear from people, but it's hard and this takes work and I'm tired. Yes, we all want to thumb our nose at exercise and all the great suggestions that professionals give us. And yes, we understand that. So sometimes allow yourself to back out of pushing yourself through, I have to do something about my MS. And we want answers. We want that thing that's going to end the fatigue now. And unfortunately, that answer doesn't exist. Managing it, minimizing it. It's okay to take a break, remembering that. It's also okay to give yourself and your body what you need to live well with MS. So remember the pacing and the balance of giving you lots of information, But fortunately, this is being recorded, so you can go back. We've both given you a lot of information. You can go back and listen to this again. Take a chance with it and try out some of the ideas that we've given you. Don't have to implement all of them today. That's more of pushing through. But just allow yourself to stay with it and try this out. And thank you so much for allowing me to share with you today. And this is your time now. I'm going to hopefully get off of share screen and bring it back for questions.
Thanks, Dr. Werfel. That was wonderful information. I was looking at the rock formations, and I'm trying to focus on the little flower, and all I could think of was the different shapes and what they look like and what kind of characters I was making them into. So it's a little harder for me to function to focus. But anyway, so folks, it's now we're ready for questions. If you have a question or comment, I'm going to give you a couple of the directions for those that are new, that aren't comfortable with the Zoom platform. If you have a question or a comment, you can ask it by using the Q&A button at on the app, which also allows you to send your question anonymously if you choose. You can also ask your question by raising your hand if you want to do it live. And to do that, all you do is click on the raise hand button or press the number 9 if you're on your phone. I'll call your name out, and then you'll just be able to unmute yourself and ask your question. So we have a multitude of questions that have come in. So let's start. I hope to not offend anybody if I don't go in complete order, but I'm going to try to get to everybody. Okay, let's do this one first. The very first one to come in, I believe, was after the speed walk rest intervention for 12 weeks. Mm-hmm. What should a PWMS do to either maintain or continue to increase their improvements?
That's a great question. And you don't, what I have my patients do is it becomes part of their regular exercise program. It doesn't have to be, to maintain, it doesn't have to be as intensive. To improve, you have to keep adding on stress. But what I usually have to tell my patients to do is at least twice a week when you go out for walking, you go out for a walk for whatever reason, try to pick up the pace for 10 steps, 15 steps, 20 steps. Do that 3 or 4 times. The problem really is that persons with MS get really good at walking slowly. And their body has forgotten how to walk fast. So you have to retrain yourself to do it. The unexpectedly good finding from our study was that with a relatively small amount of training, twice a week, 8 to 10, 20-second walks, people's endurance really skyrocketed. So it was a small dose for a big payoff. And to maintain it, what I'm seeing is that you don't need to do a lot. Twice a week, 3 or 4 20-second bursts of speed with long recovery seems to be sufficient. If you want to improve it, you have to do more.
Now, Teresa at the beginning had mentioned, I don't know what you said, that she said it's a double-edged sword. There's no way that she could walk like that. You must have been discussing at some point how to walk. She said, I'd be in bed all afternoon. So
I'm not sure what's being asked there.
Yeah, I'm not sure either, unfortunately. But I did want to mention that too, because
let me give it a shot. So we had persons in the fatigue and exercise. Thank you, Teresa. Firstly, we had persons in the speed walking where fast walking for them was not that fast, but it was faster than their normal walk. They might have been going, their normal speed was 0.2 miles per hour, and they really pushed themselves and went up to 0.5 miles an hour. It didn't seem like a lot, might not seem like a lot to other people, but at the end of the training period, they were still walking longer distances. the double-edged sword of exercise and fatigue. I hear that all the time. The key is to exercise in such a way so that the fatigue does not accumulate. And I've tried to give a few clues for that. One is to keep your body cool. The other is to take breaks. And the third is to make sure that the exercise that you're doing is related to something that you want. But the number of the other nice thing is the more you exercise, the better you get at exercise. So if you exercise, if you're only able to do a minute a day of exercise, keep that up for a couple of days, and then your body will adjust to that. And then maybe after a few days, you can do a minute and a half, or 2 minutes, or 2.5. But I also, it would be wrong of me to not strongly concur with everything that Dr. Werfel just said. Learning how to relax, to decrease the fatigue in your mind is so utterly essential. And whenever I come across a new patient with MS, I say, the two things you need to do is find 2 therapists who know MS, one physical therapist and one psychotherapist. A couple of years ago, I actually wrote an article for the MSF saying, what are the habits of highly successful MSers? And one of them is they get these therapists. They get the emotional help and the physical help that they need. And as Dr. Werfel said, they get it early on. They don't wait until it's a bigger problem. It's a first move, not a last move.
Thank you. Dina asked, what exercising do you think he or she can use for their mind?
So I can answer some of that. It's difficult. It sounds a little broad because I'm wondering if it's cognitive training. There have been some studies that have used different games and different things for people to increase cognition. But one of the things that I've heard is the best is have a number of different stimulating activities, which would be learning a new task, having a novel experience, making sure that it's participatory so that you're learning something and then you're talking about it, you're engaging with it, so that people keep on expanding is a way to keep sharper. There are specific exercises for people that have cognitive difficulty. There is cognitive rehabilitation, and that's something that a neuropsychologist would have information on. But for the average person who's saying, maybe I'm having some difficulty with a little bit of things, is to keep your mind active as possible, trying to learn new words, trying to remember things. I'm hoping that I answered that question. If I didn't,
I think that was a great answer because it's identical for physical therapy. One of my patients talks about the yuck factor. If the exercise, be it cognitive or physical, is pushing me, makes me say yuck, that means I'm probably doing the right thing. So, going something that's a little bit outside your comfort zone, that actually is what leads to something called neuroplasticity, which is one of the ways that persons with MS can improve.
Thank you. So quite a few people are asking how they're going to be able to get these slides and be able to listen to this again. And in about a day, you'll get an email with the link to do that. And this is going to be on YouTube and Facebook, but it'll be on YouTube in about a week or two. So you'll be able to go in at your leisure and go back if you need to listen to this again. So now we have Teresa's asking, when you're in pain, let's see. Oh goodness, a lot of thank yous. A lot of thank yous. When you're in pain, there's no comfortable position, Teresa wants you to know. There's just no comfortable position when you're actually in pain.
Okay,
So,
I can answer that. One of the things that our body does for us is it helps prevent us from having total shutdown, heart attack, stroke. So believe it or not, there is always a part of the body that is still comfortable. If you're not in the ambulance on the way to the emergency room because your body is completely overwhelmed, you can find a place. It can be really difficult for people that are having discomfort. And I work with a lot of people with pain management. Sometimes I work with someone that the only place there wasn't pain was hair. So you start by focusing on that, because when you're in pain, what we tend to do, all of us, we tighten up and then we end up in more pain. So what we want to do is be able to loosen up more. So we use the word comfortable enough. Is there a position that is more comfortable than some of the others? In that position, is your right leg all of a sudden feeling a little comfortable, even though your left leg might still be having some discomfort? So this isn't an easy thing to do, but finding your body and knowing that it is possible, because I've watched people relax their body when they knew that there was some comfort there. If pain is a huge issue and you're really finding that nothing that you're doing and nothing that's been suggested is working, that's when you really need to consult with your neurologist and get some understanding of pain management and maybe some medical pain management. But it goes together. So I'm thinking that answered that question.
Thank you. So I'm going to throw a thank you in there because I really enjoyed reading this one. Desiree says, I just want to thank you because she's participated in numerous webinars and in-person lectures since her diagnosis 5 years ago. Yet this session in particular has managed to skyrocket straight to the gold medal slot. You are addressing so many issues that pertain to her MS, and she feels not only validated, but she's now hopeful. So that was really very nice.
Thank you.
Thank you so much. Thank you.
Yep. Okay, let's go to mobility aids. Do you think FES devices also decrease strength, including weakness?
No, thank you for that question. FES is a special case, and actually FES, because it is the opposite of a splint, it makes your foot move. So FES has helped many of my patients, particularly there's one by Bioness, and I forget the name of the other one, but it actually does the opposite of a splint. It makes the muscle activate, it makes the muscle lengthen, and I've had a lot of patients benefit tremendously from them. The drawback is, and I say this with all due respect to many of my colleagues who work for these companies, but the device is sometimes marketed as a bit of a panacea, and it is going to help very specific weaknesses and tightnesses in the body, but it is not going to help everybody. It's quite expensive, and it is usually not covered or not covered extensively by insurance. So if I feel it's going to help a patient, I will recommend it. I usually try to go with them to the trial so that they can get my advice and feedback while they're trying it out. But in a lot of cases, it can be a good thing. I have, to be honest, seen a few cases where the patient spends a lot of money on it and they never use it because it's never that effective. So,
thank you. Dr. Werfel, what do you do when you don't have a supportive family and they don't believe you or your symptoms and invalidate them, or say treatments are so great, now you're going to be okay?
So I first want to say I am sorry that you're having this experience, and what you've tapped into is two different things that people living with MS and people living with disability in general encounter. And one is called microaggression, which is just flat out denying your experience. And the other is what is called microinvalidation. It's like, oh, no, no, don't be concerned about that. Unfortunately, we can't pick our families. What we can do is we can get ourselves to other families. There are so many support groups that are available from different organizations showing up here. But there's also support through a number of different organizations talking with other people that are living with MS. And they may not even have MS. They may have another chronic illness or disability. But getting someone that understands that you can go through it together, it is so important. Because often people that are not living with MS do not understand. And if you're living with what is called a hidden disability, people will just think, well, you're fine. You must be fine. If you're struggling with fatigue, that's a hidden disability. People often can't see it unless you are just dragging yourself. So find the people that understand, find the friends that understand, and often that might be other people that themselves are learning to live well with something. And recognize that, yes, MS, you're not dying. And some people say, well, that's great. You're not dying from cancer. Well, that doesn't help you get through the day.
Thank you. Dr. Karpatkin, Debbie wants to know, what exercises do you recommend to lessen spasms, banding in one side?
That's a big question. It's in the answer, like it is to many questions, it depends. By banding, I'm assuming you mean what's sometimes called the MS hug. That is difficult. I've had a few patients who've done a lot of stretching out of their rib cage and their thoracic spine. So stretching the trunk seems to help. Electrical stimulation has helped a few people. There's a type of PT maneuver called joint mobilization, which helps. But I often will ask my patient to speak to their physician about pain management. Similarly, for spasms, and spasms are separate from spasticity, which has to be medically managed with a medication such as baclofen. If it's a muscle spasm from overuse, then you have to really do prolonged, gentle stretching to that muscle. So you have to, and a physical therapist can help you with this. Find the muscle that's spasming, gently stretch it. So not a big, hard stretch, just a prolonged, gentle stretch, and hold it for not a few seconds, but more like a minute or two. Most people with MS stretch, they don't stretch enough. So if you stretch, say, for a minute a day, that means for 23 hours and 59 minutes of the day, you're not stretching. And persons with MS generally don't stretch enough to get the full benefit from it. That's a whole other talk.
Elizabeth would like to know, how do I decide between the different types of care, nutritionist, acupuncturist, physiotherapist, when I only have a certain amount of money and live in the area where there are no MS physiotherapists, etc.? I've tried to do a 5-minute walk per day on my own, but it only got more difficult and I can't increase the time. So
I think I can take some of that and you can take the other piece. Sometimes people make managing fatigue a full-time job and it's exhausting. I live in the Bay Area. There is not a type of healing that doesn't exist within probably a half a mile from where I live. And I could go completely broke participating in all of it. So a couple of things to look at. One, you want to know, does the person have expertise in MS? And have they had some success with MS? If it's something that's expensive or you're going to be traveling to it, has it been recommended? Do you know someone that is using this, or has it been recommended by a reputable source for MS as a way to use it? Acupuncture can be amazing and can be really helpful, by the way, for pain and stress management. And sometimes you can find an acupuncturist that's local and that doesn't cost that much money. There's physiotherapy can be really helpful. And trying one or two, and this is something you can talk about. Sometimes neurologists are really aware of all of these and talk it through, or you can try it out and see if it's working for you. So if your insurance will pay for it, it is definitely worth a try. If it's not going to exhaust you, but it's always balancing out. No matter how many things I've tried, there's always someone saying, but have you tried this for MS? But find something that works for you. And it can be many different things.
Thank you.
Let me tag on there. So I hear from my patients a lot that, well, I used to go to physical therapy, but my insurance stopped paying for it, so now I don't do anything. And that is not really understanding what physical therapy is. A physical therapist, in my opinion, isn't somebody who stands over you and says, okay, 5 more, 4 more, 3 more. No, a physical therapist is one who should be one who gives you an exercise program to follow. Okay. A lot of my patients I see once every 2 weeks or 3 weeks or 4 weeks, and I give them a program to follow and they stay in touch with me. In terms of finding a therapist who isn't knowledgeable in MS, there is an enormous amount of information available to physical therapists about how to work with MS. I know because I've put it out there. The information is available, and it's worth giving a bit of a calling people and saying, what, as Dr. Werfel said, what is your experience with MS? What is your training? Have you treated MS patients before? In the same way, you wouldn't want to see a dermatologist to treat your MS. You want to get a neurologist who specializes in MS. The same thing for therapy, whether it's physical therapy or psychotherapy. But you have to do a little bit of due diligence here and reach out to the therapist in there and say, what is your training? And the other thing is, and this happens to me a lot, any therapist who wants to call me can do so to discuss a patient. And that happens to me several times a week. So I'm very accessible. And if a therapist needs some feedback from me on how to work with an MS patient, I always endeavor to do so.
Thank you.
So the therapists are out there.
Dr. Karpatkin, somebody's asked if you have a website with the exercises that you discussed today.
Unfortunately, I don't, but maybe I should set one up through the MSF.
Sounds cool. I don't know. We'd have to talk to Casey, but that was a good question.
I'm on board.
Yeah, sounds good.
Okay.
We get a lot of people asking.
I am so there. Look, my term ends in a few weeks, and I have the summer in front of me. Let's make this what I did on our summer vacation.
Oh, is it best to exercise every other day versus every day?
Yes. No. It's so, in my opinion, you should exercise every day. The problem is, how are we going to define exercise? If the exercise is, for some people, it might just be doing some calf stretches, going for a short walk, and doing some deep breathing exercises, and maybe some mindfulness meditation. Yeah, you should do that every day. But with MS, it really runs the gamut. I have some people who, as Dr. Werfel described, just getting out of bed and getting dressed is a Herculean task. And I have other patients who are mixed martial artists and marathon runners. So it really depends on your individual status with the MS and what your goal is, what you're trying to accomplish. when somebody says they need an exercise program, says that to me, they say, good, what do you need it for? What are you trying to accomplish? Is your goal, to be able to climb a flight of stairs, to go for a walk without losing your balance? Is it to be able to go shopping and go to the corner and come back? A surprisingly common request I get is, I want to be able to walk down the aisle at my wedding. So the therapy should be specifically measured to what you're trying to do. So for your question, it's going to really depend on what is your MS and what are you trying to do. It's very individualized. Generally, try to do something every day, even if it's just deep breathing exercises. Sedentariness loves sedentariness. And the more sedentary you are, the better you get at it. So I try to really talk people out of that.
Thank you. We're going to take just a couple more questions. But Brenda's asked that her left leg is weak. That's her weak leg. When she gets behind the wheel of her car and she lifts her leg manually into the car, what exercises might she do to strengthen that leg and increase her ability to move her leg under her own power into the car?
Oh God,
An easy one or a hard one?
It would be easy if I could see her in person, but it's, I can't. I don't particularly want to try to give an individual answer to individual thing. I mean, but some type of seated leg raise, just sit in a chair and raise your weaker leg up and slowly lower it down and practice that. That's not an uncommon question that I get, though, raising your leg into a car. So, but I'm so sorry, but it's very difficult to answer a question like that without seeing the person or doing an evaluation.
And is there a way to answer why one side, because somebody's asking, Melissa asked, not Melissa, let's see. Somebody, I'm going backwards. Somebody asked why the left side is not strong and the right side is. Is there a reason?
That's just how the MS is expressing itself, because that's the side of your brain or spinal cord that the MS is demyelinating. So, but it's not uncommon. I see many people who have what is called sidedness, where one side is weaker than the other side, or one side is tighter, or one side is poorer sensation than the other side. That's actually very common.
Okay, and our last question is not really a question, but I had to address this. Teresa said, I went to a PT who told me that we can keep the muscles from weakening, but we can't get them stronger. And she said, what?
Teresa, you are correct. So don't go back to this guy. Assuming he's a guy. That is just completely wrong. I don't know. I mean, maybe he didn't say, I'm trying to be kind here, maybe he didn't say what he meant, but there's absolutely no research whatsoever to back that up. I get people stronger. I'm nothing special. You just have to know how to work with people with MS.
Thank you. And we're going to stop there because we have gone way over time. Thank you both for allowing us to go past the normal time. But I would encourage, if you guys are okay with it, the two speakers, then if somebody has a question that has not been answered today, if they could send it to the email address that reminded them of this meeting tonight, then I can forward it to you. And if it's not something personally related to their care, would you be willing to answer that for them?
Absolutely. Absolutely.
And I would encourage everybody to do that. Thank you for agreeing to that. So then that brings us to the end of our time. And if you missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for information on how to access recordings or to sign up for our newsletter to learn about upcoming events. Also, you'll be receiving a short survey when you leave the conference. We greatly appreciate your feedback, which helps us determine not only what type of information is going to be in the next ones, but also what's most meaningful and helpful to you as the attendees of these conferences. Our next teleconference is this coming Thursday at 7:00 p.m. and it's going to be with Dr. Tyler Brown from the Shepherd Center in Atlanta. He'll be speaking about how to get your family to really listen to what you want to talk to them about your MS. So it should be quite interesting, and our sincere thanks to all of our attendees for your participation, and especially to Drs. Werfel and Karpatkin. Thank you so much for the time you spent to prepare and to share this information with us tonight. Good night, everyone, and we will see you next time. Thank you very much. You're both
Thank you,
wonderful.
everyone. We'll be in touch.
Wonderful. Bye-bye.
Thank you, Dr. Werfel.
Thank you.